Welcome to Learn Medics. Today we are going to deal with necrosis. In this mojo, we are going to deal with types of necrosis and gross and microscopic changes that occur in a tissue which undergoing necrosis. Necrosis is a form of cell death in which the cell membrane loses and there is leakage of cellular contents due to the cell membrane. So the leakage of cellular contents which results in inflammatory process which affects the tissue bed. The necrosis is categorized into different types according to the gross and microscopic changes that involve in a tissue. So, according to the gross and microscopic changes, necrosis is categorized as coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, fat necrosis, and gangrenous necrosis. Coagulative necrosis is the most common form of necrosis in which there is preservation of tissue architecture remains for days. Like we know that there is if an injury occur into cells, there is also damage that occur into the enzymes. These enzymes are responsible for the proteolysis. When a damage is happens to a cell, there is a loss of these enzymes and it limit the proteolysis. So, due to the limitation of the proteolysis by the loss of enzymes, their tissue architecture remains over intact days, which is the major difference between coagulative necrosis and the liquefactive necrosis. The cells ultimately goes for the phagocytosis of the cell remnants, and it also takes time. So grossly, if we are looking for a tissue of necrotic coagulative necrosis, we can see the tissue becomes red, firm. Like here in the kidney, we can see a firm tissue present over here. This is grossly we can see the firm type of tissue. When we are looking microscope, the architecture is preserved. The cell nuclei lost due to cell damage. Red or pink color on H&E stain, in which like damaged cells takes up more stain because loss of membrane, and there is an inflammatory cells influx. Like due to the cellular leakage, there is inflammatory cells influx. For example, in the case of infractions in myocardium and ischemia in kidney or spleen. Here we can see the normal heart over here, and we can see the myocardial. After myocardial, the microscopic changes occur in the heart. The exception for the coagulative necrosis is brain. Like brain also gone under some infraction, means stroke. So after the brain stroke, we have only liquefactive infraction, no the coagulative necrosis. That is the major exception for the coagulative necrosis. Second type is the liquefactive necrosis. The main cause of liquefactive necrosis is by the bacterial or fungal infection happening to the tissue. Also, some strokes, like brain strokes occur, and after that the brain undergo liquefactive necrosis, which I mentioned a slide before. So, during this infection, there is inflammatory cells are drawn into the tissue, and these inflammatory cells drawn into the tissue, and it become liquefied. The tissue become into a liquid thick mass, which leads to tissue death by the enzymes from the microbes and enzymes from lysosomes. In the topic apoptosis, I mentioned that there are a lot of enzymes present. Lysosomes are responsible for various types of cell death. So enzymes present in this lysosomes of dying cells also responsible for the tissue death. So if we look grossly on a organ that having the necrosis, liquefactive necrosis, we can see liquid or pus or abscess cavity. Here in the brain, here we can see the structure of brain grossly that undergone stroke. So here we can see a liquid or pus or abscess cavity. So in microscope, if we visualize in microscope, we can see numerous neutrophils in the tissue that undergoing liquefactive necrosis. Next one is the caseous necrosis. There is a cheese-like appearance present in tissue that undergoing caseous necrosis, which is rarely occurs in outside of tuberculosis infection in lungs. It is a classic finding of Mycobacterium tuberculosis infecting organs. That is, any organ in grossly have a cheese-like appearance means it is infected by Mycobacterium tuberculosis. The mycobacteria are very resistant to digestion by phagocytes like macrophages. So the macrophages form giant cells leading to granuloma formation. I have a video on granuloma formation inflammation. There I mentioned about all the thing of granuloma formation. So The mycobacteria very resistant to digestion by phagocytes like macrophages. So the macrophages form a giant cell leading to granuloma formation. This slow break down the infection. The infection is going high, but the resistance against the infection is going down. So infection is high because of Mycobacterium tuberculosis. The loads of mycolic acid and lipid give cheese-like appearance. Grossly, if we analyzing the structure that undergone caseous necrosis, we can see the cheese-like or caseating substance. Here we can see cheese-like or caseating substance present over here. And if we are going under for microscopic examination, we can see the granulomatous inflammation and which have a necrotic center ring of lymphocytes. Here we can see the ring of lymphocytes and macrophages and epithelial cells and giant cells. Next one is the fat necrosis, which is the necrosis of fat, which is present mainly in acute pancreatitis. The acute pancreatitis is common due to the leaking of lipases produced from the pancreatic cells, which break down the peritoneal fat. Fatty acids combine with the calcium, which leads to the saponification process and which leads to the formation of chalky white tissue. Fat necrosis is also present in the breast, like it's from the results from injury, often after biopsy, surgery, and sports injury or seatbelt injury happens to breast, which can mimic the breast cancer. It is not a breast cancer, but it's due to the fat necrosis of breast. Here we can see the large vacuole type fat necrosis present in the breast cell. The next type of necrosis is the fibrinoid necrosis, which occurs in blood vessels. Mainly it occurs in blood vessels. Now gross findings, only microscopic findings are present because it occurs on only blood vessels. It is mainly due to the autoimmune disorders. There is antibody antigen complex deposit in vessel walls, and it is a type 3 hypersensitive reaction. Fibril links into the vessel wall and pink on microscopy. Here we can see a pinkish color on microscopy, which is due to the fibrinoid necrosis. The last type of necrosis is the gangrenous necrosis, which is a subtype of coagulative necrosis, which is caused by ischemia. There is a loss of blood vessels, blood supply to the limbs and bowel, which involve a multiple layers of tissue damage occur. The gangrene can be classified into two, that is dry gangrene and wet gangrene. The dry gangrene can see the feet of people with a peripheral vascular disease, which is seen to be like dry, black and shrunken tissue. Here we can see dry, blackish and shrunken tissue due to the peripheral vascular disease of adult. And the second type of gangrene is the wet gangrene. Like if this dry gangrene impose some infection leads to wet gangrene. So we superimposed bacterial infection on dry gangrene leads to wet gangrene, which is a coagulative necrosis and liquefactive necrosis. We have both type of necrosis in a same same tissue, coagulative and liquefactive necrosis in same tissue, which means the wet gangrene. If we examine the tissues that undergo wet gangrene, it should be moist, soft, swollen, pus and foul smell. You don't forget that smell if you have a patient with wet gangrene. So that's all about the necrosis. Thank you and have a grateful study days.